Hello and welcome everyone. My name is Victor Yosha and I serve as the Climate Policy and Projects Officer at Healthcare Without Harm Europe, where I manage projects such as the 100% renewable electricity commitments of healthcare institutions, which is the topic of this webinar today. And we are organizing this webinar jointly with the Global Green and Healthy Hospitals project, of which we will soon hear more about. And I'd also like to mention that over 80 people have registered today. And even for those who are unable to join now, the webinar is being recorded and will be published together with the speakers' presentations on the No Harm Europe website. And I'd like to ask you, if you have any questions throughout or after the presentations, please use the chat box and send your questions to us, and we will make sure to have them answered by the presenters. And before we dive into our topic, I'd like to give you a short introduction to our work at Healthcare Without Harm Europe. So, Healthcare Without Harm is a non-profit coalition membership organization of hospitals, healthcare systems, healthcare professionals, local authorities. Here I also mean subnational governments and regions, research academic institutions, and other environment and health-related organizations. And our aim is really to bring the voice of healthcare professionals to the European policy debate about these issues, about these policy areas that we're working on, such as chemicals, climate change and health, green buildings, sustainable procurement, as well as pharmaceuticals, sustainable food in our hospitals, and waste management. Furthermore, also to educate and empower the healthcare sector to understand the importance of the environment and pressure this and put pressure on healthcare leaders and professionals to advocate for a broader societal and policy change. What is the mission and vision of Healthcare Without Harm? We have a vision of a healthcare that mobilizes its ethical as well as political and economic influence to create a sustainable and ecologically and equitable, healthy world. And the mission is to transform healthcare worldwide so that it reduces its footprint, overall environmental footprint, also carbon footprint, and become a community anchor for sustainability, and also a leader in this global movement for environmental health and justice. And when it comes to our overarching goals, we identified 3 key areas. And one of them, is protecting public health from climate change as a very overarching goal of environmental issues, but as well as to transform the supply chain through sustainable procurement in healthcare. And thirdly, to build leadership and demonstrate leadership for environmental health through the voice of healthcare and health professionals. Our main policy areas among climate and energy is pharmaceuticals, safer chemicals, waste management and resources, sustainable procurement as addressed before, as well as sustainable and healthy food. Talking about our members, currently we're working with 88 members in 25 countries of the European WHO Europe region, including 16 member states of the EU. And membership in Healthcare Without Harm Europe is based on an organizational commitment to the mission and goals of our organizations, which I've addressed in the previous slide, and a desire to participate fully in helping to achieve these commitments. And our members mainly consist of hospitals, we work mainly with hospitals, as well as other kind of healthcare facilities, regional authorities, subnational governments, professional associations, and other NGOs. And regarding our work on climate and energy, we've been working on this and reducing the carbon footprint of healthcare since 2009, and we are engaged in the European debate on climate change as well as energy targets since 2010. We have recently published a fact sheet on reducing the carbon footprint of healthcare through sustainable procurement, which you can see in the first picture below, the cover picture. You can find it online, together with our webinars, workshops, and reports, which are all available on No Harm Europe website. And today we're going to have 3 speakers addressing our topic. And the first one is going to be Nick Thorpe. Nick Thorpe is the network director of Global Green and Healthy Hospitals. And as addressed before, GGHH, as we call it, is a project of healthcare without harm. And most of the time, Nick works with GGHH staff around the globe to engage members, to build communities of support, and connecting them to the tools and resources that can best assist them in achieving these goals and commitments. Nick has over 10 years of experience in the sector and is working related to environment, public health, and sustainability. So I'd like to give the floor to Nick to begin with his presentation. Please, Nick, the floor is yours.
Great, thanks, Victor. And it's a pleasure to be with everybody today. Good morning or good afternoon, depending on where you're located. I'm really excited to share the kind of evolution of the work that Victor mentioned on that Healthcare Without Harm has been doing on climate, and really the progression that we've seen in the health sector over the last several years to really be taking a leadership position in addressing climate change, not only at their facilities, but advocating for change broadly in the sector and around the globe. We're going to talk specifically today about the movement related to 100% renewable electricity, and there's going to be some great examples from within Europe about organizations who have made this commitment and them talking about a little bit about how they're going to reach it. The 100% RE is a piece of our climate work and something that we began working on really just this year in the lead up to an event that happened in San Francisco in September called the Global Climate Action Summit. There was an organization called the Climate Project that has been for the last several years working across all kinds of sectors to advocate for corporations, companies of all size, organizations to really step up and make an ambitious target to 100% renewable electricity. It's gained a lot of momentum. I think they have close to 200 different organizations that have signed on to them. Really a broad, diverse array of types of companies. They have companies such as IKEA. They have different airports that are involved. Really a broad array. And one thing that we saw when we were looking at this is that we didn't see anybody from the health sector. Yet we knew this work was happening, and we knew the health sector was also stepping up to make these ambitious targets. And so over the few months before the summit happened in September, we began kind of promoting this and doing some outreach to see who was taking this ambitious target, where they were from, and really what the impact of all this work would be. And we were really happy to see that it's happening in all parts of the world. So far to date, we have 20 different healthcare institutions who have made this public commitment to 100% RE, and we know there's more out there, and we know there's a lot of great work happening. So it's really exciting to be seeing this, again, as I mentioned, progression in the work, and want to share a bit with you today about more of the climate work that we're doing, and showcase a bit of the 100% renewable electricity work that's happening in other parts of the globe. So one of the projects that we've been working on, in addition to what Victor mentioned, the work that we've been doing over the last almost 10 years on climate and climate and health, is in 2015 we launched something called the Healthcare Climate Challenge. And this was kind of a project of Healthcare Without Harm and Global Green and Healthy Hospitals to begin kind of organizing the health sector around the globe on this topic. The climate challenge is set up in a way around 3 different pillars or focus areas, being mitigation, resilience, and leadership, all of which we see through being a big step towards with commitments to 100% renewable electricity, because that is a major reduction in carbon emissions, which would be mitigation, It's becoming independent from public infrastructures through renewable energy in many parts of the world, which is resilience. And then it's really an ambitious public target, which we see as a real leadership step to motivate others in the health sector and others in other sectors to step up to this commitment in the same way. And so the Healthcare Climate Challenge, to date, we've been working with now over 180 different healthcare organizations in 26 countries around the globe. And these organizations represent the interests of over 17,000 hospitals and health centers. So it's a really exciting movement that we're seeing. It's great to see healthcare institutions making public commitments and putting their name on something that says we see climate change as a major issue. We know that us as the health sector have impacts that we want to address, and we want to use our powerful voice and actions to advocate for broader change. As we've been working on the Healthcare Climate Challenge, we also worked in 2017 on a report with the World Bank on climate smart healthcare, which is a great report that I encourage you to look at if you haven't already seen it. But that brings together an idea on climate smart healthcare being both mitigation and resilience, and that as the two come together, they help achieve one another. And this report has really great examples from around the globe about how different healthcare institutions in different contexts and different size, both rural and urban, are taking these approaches. And some really great examples that we hope we can continue to add to through the work that you're all doing in your part of the world. So back to the renewable electricity, as I mentioned, we were really impressed and by the ambitious targets that we saw coming in from different parts of the globe. Again, the organizations that have made this commitment so far they come from 12 different countries. Again, all different kinds of contexts, large and small, urban and rural, really large, complex health systems to small clinics. We saw all different types of healthcare institutions coming in around these commitments. So I just wanted to share a few from outside of Europe to give some examples of what's happening, and then look forward to hearing the examples from Denmark and the Netherlands from our other speakers today. So one place that we're seeing a lot of work on renewable electricity happening is in the country of Nepal. Nepal has, in a lot of parts of the country, has infrastructure issues where dependable electricity is not available all the time, which makes delivery of care difficult to provide if they can't rely on a solid electricity infrastructure. So renewable electricity there is taking the shape of being the priority of being able to provide consistent and dependable care to their communities. In doing so, they're obviously mitigating their carbon emissions. In several instances, small clinics are actually becoming carbon neutral with the addition of on-site solar or wind power. And so it's a really interesting, look at how the renewable electricity can provide really great care for a community, and also serve as an example of how they can reduce their carbon emissions. In the US, we're seeing a big movement on renewable electricity. These 7 organizations that you see here have all made the commitment to 100% renewable electricity. In some cases, they're taking that commitment even farther to be what they're calling carbon net positive. So in effect, producing so much energy that they're contributing it back to the grid. And these, again, are some of the leaders in the US healthcare sector. Some of the biggest health systems, individual medical centers, who are really stepping up to make this commitment, and doing so in very different ways. Some are working with power purchase agreements with electricity providers to develop renewable electricity capacity for them. Some are doing things on-site, putting wind and solar, geothermal even, on-site and using that for their own facilities. Others are financing the development of wind farms or solar farms, either close by to their hospital or in other parts of the country that then they're contributing back to the grid and can use that to mitigate their own carbon emissions. So in the U.S., really great, diverse approaches to achieving 100% renewable electricity, and really pushing this forward and making really ambitious targets to inspire others to follow. In Africa, we see kind of a similar situation as we had in Nepal. The United Nations Development Program has started a project called Sustainable Energy for All, where they're actually working with, in different countries in Africa, to provide solar power to, again, allow for dependable and reliable care to happen at healthcare facilities. It's also been helping provide cooling for vaccines to ensure that those aren't lost because of lack of electricity and cooling. It's providing care for maternity wards, so people can come and have babies and know that they can do so in a safe and clean setting. It's really been a big boom for several countries, Zambia and Zimbabwe that you see here, which they're focusing in with goals of providing renewable electricity for over 400 different facilities in a country. So again, different approaches, different types of partnerships. Again, this one we're working with the UN. In the US, partnerships are happening with electricity utility providers. Some are doing on-site, some are doing off-site. I think really the power of this is the diversity that people are approaching the work and the strategies that they're using to achieve them. And that's something that we really promote a lot through the Healthcare Climate Challenge and Global Green and Healthy Hospitals, is to create a network of exchange so that we can learn about the work that's happening in different parts of the world or different parts of our own region or country, learn those strategies, see how we can apply them to our own work, and share our own strategies and successes for others to learn. So really excited to hear the examples that come from Europe, and also very excited to be able to work with you all and welcome you all to join Healthcare Without Harm Europe, to join Global Green and Healthy Hospitals and the Healthcare Climate Challenge, and work with us to move this work forward. Thank you.
Thank you very much, Nick. And as we all heard, it's all about stepping up, making these commitments, and demonstrating these commitments. And joining the challenge is one step towards this. So for the next speaker is Eric Mimel-Korting from Radboud UMC, one of our most active members in the network. And Eric is the manager of real estate and medical technology, as well as program manager of sustainability at Radboud University Medical Center. And in his role, Eric is responsible for managing all real estate and the safe use of medical equipment at Radboud. And since early 2017, Eric also served as the program manager of sustainability, and the 100% RE commitment is one of the milestones that the program has reached since the start in 2017. So I'd like to give the floor to Eric. Eric, please.
Thank you. And thank you for the opportunity to share our plans and our experience with the rest of the world. Our mission of the Radboud University Medical Center, I will call it the UMC for short, is to have a significant impact on healthcare. And we are very proud that in our sustainability group we have been able to add another sentence to that, and without any impact on our environment. So it's that important for us to be able to provide good healthcare without an impact on our environment. And of course, energy and energy use is one of the main resources in achieving less impact on the environment, and that is why we have spent a lot of time and a lot of effort to realize this. Now I can do it myself. One part that has given a lot of momentum to this movement is the change in our real estate. As you see here, here is a very simple overview of our campus. And you see two very large white spots on the left and the right of the campus. And if I may point them out, these parts of our campus are now built and they will be green in the future. So we are going to reduce the amount of real estate in the coming years with about 25%. And that also gave us the incentive to look at the energy uses of the rest of the remaining 75% and see if we could reduce the carbon production of that real estate to as close as zero as possible. And for that we formulated our new ambition to be carbon neutral by 2030. And preferably we would like to be energy neutral also, but the main challenge there is if you look at the small picture of our campus in the right lower left of this sheet, you will see that we do have a lot of open space on our campus, but we are not allowed, and we really do not want to sacrifice all that open space to energy production. So we can achieve carbon neutrality, but we were not certain if we could achieve energy neutrality. And it's quite a big challenge. To look at the numbers, we are using on our whole campus 110 gigawatt hours of electricity per year and 12 million cubic meters of gas. So it's a long way to go. What I've already told you, we have no opportunity to produce all this energy on campus. So we first had a plan to invest in our own energy production off campus, but that's also very hard for a university medical center because we cannot do that on our own. And last but not least, we also make steam for some processes, and there was no efficient production of steam available yet. But still, we went on with the challenge. If we look at the university medical center, the hospital part, the challenge is about half the electricity and about 2/3 of gas usage. And why I mention gas in this presentation is because if you look at our plans to reduce gas consumption, some of this consumption will slide over to electricity because we are going to use heat pumps for heat and maybe even for hot water. So this slide of this transition in less gas will probably mean that we will use a little bit more electricity. But even then, if we succeed in getting this energy to us completely carbon neutral, then it's a good step. So what we wanted to do is to look at market opportunities to get electricity fully carbon neutral as soon as possible. And 2018 was the right time because our current contract ended 2018. So that was the moment to take action. And what we really wanted to do is not simply purchase carbon neutral energy, but we also wanted to get the market moving and add additional generation capacity to the already existing installations, because we do not want to buy someone else's energy, to be simple. What further complicated it for us is that European rules forbid us to do this bilaterally. So we had to create a tender in which these goals were tenable. Because we did not have any experience with that, our approach was to approach the market first to see what is reasonable to ask, what kind of tender would benefit both us and the developers of green electricity generation. And that gave one surprising result, because our first plan was to also invest ourselves in generation capacity, because we wanted to really be the owner of this generation capacity. But from the market consultation, it turned out that more complicated this tender and complicated the achievement of our goals, they made it easier. So what we did is to leave that from our tender and to go to the market with a quite simple proposition to get a portfolio of sustainable generation to be realized before 2024. So what we really ask the market is give us plans to create new generation capacity, renewable generation capacity before 2024. What we also wanted the market to offer us is to invest in small projects in our own neighborhood. That is everything to do with our new buildings and the regulations for making those new buildings energy neutral. And what we also wanted to do is pilot ways in which we can match our energy consumption to the energy production. And that is the hourly matching pilot, because what we all know is that renewable sources tend to have a very dynamic profile of delivery. And if we can match our consumption to the peaks and the trenches in delivery, you do not have to create a lot of intermediate storage of energy. So those were our main quality demands in the tender, and of course price was also important. But I must say we focused more on quality than on price. And I'm very proud to say that we succeeded in this for us quite experimental purchasing tender, and it resulted in a contract with Eneco, that's a Dutch energy supplier, for a period of 10 years. That's also a break with tradition, because in the past contracts we only contracted for 3 to 5 years. But we also saw from the market consultation that if you really want to commit to renewable energy, you have to give your market partner a chance to do that for a bit longer term. So we came to a conclusion that 10 years was a good contract period for both us and for Eneco. So Eneco promised us to create new sustainable generation for our complete demand before 2024. And I'm happy to say that we are probably going to realize 50% already in 2022. And we have committed ourselves for a period of at least 10 years to this contract. So hourly matching, I told a little bit about that. That's also part of the contract. It's really innovative. I'm very excited to see what we can do there. But this picture shows, in fact, the problem you have with some sources of renewable energy. There are peaks in generation, and there are really great lows. And in balancing the source, but also in balancing your demand, if possible, we can, together with our supplier, see to it that demand and production are reasonably in balance. So we will not have to add our completely renewable energy with quote unquote non-clean energy. So we want to do at least one pilot, and maybe it will be common business in about 5 to 10 years. So if you look at the economic side, that's also a very important question normally, is how does this translate into numbers? And I must admit, it is a little bit more expensive. If you look at the second bullet, we are going to spend about 240,000 euros per year more in energy. But I must also say that I do not know which part of this is normal market price development and which part is really because we are doing something quite new, opposed to buying non-renewable energy. So I think it's about 50-50. But we are certainly willing to invest this, well, 2 to 3% extra in renewable energy, because if you look at the CO2 reduction, that's really significant. And that's what we are doing it for. We are also expecting our government to really go into taxation of CO2. And in this way, we are in fact getting some bit of insurance policy against those price increases. So this will result in a reduction of 30% of our current CO2 footprint, and that's really worth all the financial efforts we put into it. So our win is not financial, our win is a contribution to carbon reduction. So of course this is not the end. We are going to do a lot of more things. Of course, if we go to completely renewable energy, we have to further reduce our gas usage. And Nick also mentioned that one of the things we are going to do, probably or going to explore, is ultra-deep geothermal energy production, so that we can both get our hot water production and our steam production on a renewable energy source. It's not clear in which time frame we can reach these goals, but they are certainly that's certainly something we want to do. And what we always also want to explore is to convert our waste into energy without carbon production. That's also, we have two innovative solutions scheduled that we want to explore. And with these steps, we are expecting to be completely carbon neutral, also for heat and steam production around 2013. So it's still a way to go, but the first major step has been made, and we are very proud of that and very proud of the opportunity to share it with you. Thank you.
Thank you very much, Eric. And as you heard, today Radboud's win is not financial. It is their contribution to mitigating climate change. So this return of investment really lies in the health of the population, as we have a question addressed to Nick Thorpe. So the question is, what does it mean exactly to commit to the healthcare climate challenge?
Sure, that's a great question. So there is a pledge that we've created that really kind of frames the opportunity for the health sector. And again, this is framed around the three different pillars of the climate challenge: mitigation, resilience, and leadership. So we asked that an organization interested in joining signs on to that pledge. And then there's a lot of flexibility after that. We do ask that if it's a hospital, a health center, or a health system, we ask that they set a target for some point in the future of what their mitigation targets are going to be. It doesn't have to be 100% renewable electricity. It could be a target set by your own organization. And then we ask that you report on that each year to demonstrate your progress, as well as reporting on the different activities you're doing related to resilience and leadership, for which we do annual awards every year to recognize the participants and the great accomplishments they're doing. So signing on is, again, available on our website, signing on a pledge online, and then setting targets for your ambitions going forward.
Thank you, Nick, for answering this question. And as said, all this info is available on the Healthcare Climate Challenge page of the GGHH website. And a next question, what is your forecast when the sector can reach zero carbon emissions? Think about Paris Agreement or the IPCC 1.5 report.
I think that's it's a really complex question. It's a good question. I think it takes the initiative of the organizations we see here, like Radboud University Medical Center. We continue to want to push for change and policies for change, happening at international levels or regional levels or national levels. But sometimes those don't move as quickly as we hope they would. So I think it's organizations like Radboud and Capital Region of Denmark, and the other organizations that I mentioned, and all the organizations participating in the Healthcare Climate Challenge, who are stepping up and making these commitments that go well beyond what they're required to be doing. So I think it's that groundswell that'll be a real indicator, I think, for how quickly we can reach our targets, how quickly we can achieve where we want to be, and our hope is that at that time is that we build that groundswell that demonstrates to policymakers at all different levels that this is not something happening on the outside. This is becoming common practice that should be supported. And so I think it's going to take a combination of the two together. I wish I could give a firm date on when we could achieve that, but I think it's again, these types of commitments are demonstrating that it's progressing really quickly. And even last year, we weren't seeing these types of commitments being made. So that progression is really important.
Yes, absolutely. And I think if we take the Paris Agreement as well as the recent IPCC 1.5 report, both of them call on all actors really, sort of a bottom up rather than a top down movement as we've seen in the past on UN conventions. And if Eric, if you also would like to answer or address this question, please feel free, as your institution's commitment is very relevant when reaching this ambitious goal.
I think if you look at the Paris Agreement, 2050 would be the real end point. And what Nick said is we are doing at this time more than we are obliged to do, but it's all to do with timing. The timing is correct for us because we are in the midst of this real estate transition. And I think it's important that every institution is going to look for their own perfect time to make this step. But evidently 2050 seems very long away, but those who are able to do something now, I think really should.
Right, and we always put in the front and highlight these initiatives that we work with institutions on the ground, and together they can make up a significant amount of the carbon budget that we're counting with, this strict carbon budget that we have left to achieve the 1.5 temperature scenario. Okay, we have a question here addressed to Nick. What was the reaction to these commitments, what were the reactions to these commitments, both within hospitals themselves and also in the wider community as well as other sectors?
That's a great question. I think, the reaction, being able to bring these commitments to the Global Climate Action Summit in San Francisco was a really important moment to be able to demonstrate that the health sector is playing a part in this. And it's also demonstrating the need for health to be part of climate discussions and climate to be a part of health discussions. And we really saw that come to the forefront at the Global Climate Action Summit. In terms of governments and the organizers of the summit, really showcasing this climate and health connection that I think is a result of the health sector stepping up in this ambitious way. And I think within hospitals, I think Eric maybe be able to answer that better, but I think it a lot of this work for renewable electricity, it's not only being able to provide electricity from renewable sources, but it's also being able to become more efficient so that electricity that is coming from renewable sources is enough to power the facilities. And so that really takes all staff to be able to do that. It takes staff engagement to become more energy efficient, at all different levels. And so I think what we've seen is that it creates a lot of ownership. An healthcare organization setting out a target like this, it creates a lot of ownership from staff to be involved and feel like they're making their part in helping to achieve this target.
The next speaker is going to be Ole. And as said at the beginning, we mainly work with our diverse network of members who are working on the ground on reducing the environmental impact of their institutions, working also with regions, subnational governments, can really result in significant emissions reductions as regions work with several health systems, such as the capital region of Denmark. And Ole is today with us, here with us, and he is the chief consultant in green transition at hospitals in the capital region of Denmark. And Ole has extensive experience with green transition and change management in the public, private, as well as NGO sector. And he covers areas such as strategy and organizational development, governance, green innovation. And for the past 9 years, he has been working with the capital region of Denmark and is currently working on this ambitious 2025 climate program at hospitals in the region. Ole, please, the floor is yours.
Thanks a lot for inviting me to speak at this webinar. First of all, I will explain what the capital region of Denmark is. Denmark is divided, the healthcare system in Denmark is divided in 5 geographic sections, and I work in the capital region of Denmark. The red part with the circle is the capital region where Copenhagen is situated. Basically it's 7 big hospitals on 11 different locations, and the central administration where I work is that's 7 centers, and I work in a center for facility management. We not only run the hospitals, but we also work with regional development with the municipalities, and that's environmental work. It's work with mobility and transportation, education, and research and innovation. The vision of the capital region of Denmark is that we is a green and innovative metropolis with a growth and high quality of life, with cutting-edge green solutions and a health service that meets the very best international standard. And on these photos shows some things that we want to be known for. That's green transportation, lots of bicycles all over, and renewable energy, windmills, and organic food are some examples. Well, if we go into this to talk about green transition at the hospitals, there was a changing point in 2013 and 14 because we got new leadership, both politically and administratively. I forgot to say that the regions are run by politicians, and we got new leadership in these years. And that was a change for the work with green transition and green energy, because we changed from having the environmental and the climate work more like a project-based, smaller projects. But with this new leadership and management, there was a will to put the green transition into the core of the corporation, you can say. And the thought was that we can provide a healthcare service and be sustainable at the same time. Well, this program for climate, we call it Green Operation and Development, and it's basically 3 thematic plans where we analyzed that the potential for carbon reduction was biggest. That's in the area of energy, waste and resources, and transportation. And we have long-term targets, 2025 reduction targets with activities to fulfill the goals. We have 3 supporting themes. That's green procurement, in this talking about renewable energy and energy efficiency, it's demands when we buy standard electric equipment, it's easy because they are it's all you know, with different kind of national methods, and then also energy reduction on the big healthcare equipment. Communication is important in order to get support from the whole corporation. All the employees has to back up the efforts we are doing, and we can't. The third supporting theme is green growth and innovation, and it's impossible for us to reach the goal without a lot of innovation. So we work together with private companies and knowledge institutions, universities, and NGOs like Healthcare Without Harm to provide this necessary innovation. Governance, how we have to make a new system of how to make decisions, how to coordinate, and how to exchange knowledge and experiences across the whole corporation. We are 40,000 employees, so it's quite a big for Danish standard. It's a huge company. And the last ingredients in this climate program is a management system where we on a yearly basis can monitor how it goes, and we plan activities for the next year, every year in a circle, management system circle. The Energy Plan 2025, the background is that we have a huge expenditure on energy, that is heat and power, approximately 70 million euro yearly. And there was a big potential for further energy efficiency. Although we have invested quite a lot of money on energy efficiency projects, there's still a huge potential, especially in the areas of ventilation, lighting, products and equipment, building automation, and CTS smart buildings. And to much lesser extent, local conversion to renewable energy, because in Denmark, we both heat and power is coming from public grids, and the national plan for reducing carbon emissions is driven by conversion of centralized and decentralized power and heating plants. So when we talk about local renewable energy, it's very little amount actually of renewable conversion is actually taking place at the hospitals, because but in a total view, it's more effective to do it jointly at the big plants. This is the targets, 2025 targets. We decided a 60% reduction in 25 compared to the baseline in 2030, and in 2035 we expect 100% renewable energy supply, both heat and electricity. And as I mentioned, this transition is driven by centralized transition of energy. And the graphics on the right shows the targets for reduction in energy consumption, because we think that when you talk about installing renewable energy, you should always first think about how to reduce the energy consumption, because there are huge capital costs involved in installing renewable energy. So the first step is to do as much energy efficiency projects as possible. And there we have we expect to reduce our energy consumption with 16 to 17% from now to 2025. The main activities in the energy plan is huge ESCO projects. I don't know how many of you are familiar with ESCO projects, but that's you get a private partner to do actually all the work from screening to design and implementation, and the private partner provide financing and make a warranty that you actually reach the reduction goals you want, and that's our main activity. And we have designed a new concept for ESCO called 3.0. I will talk about that very soon. And the expected investment in energy saving projects is about 1 billion Danish crowns. That's in euro. It's about 130 million euro. And we have expected a completion before 2025, and approximately 1.2 million square meters are included. Also, increased efforts for energy efficiency, efficient procurement. I talked about that before. That's basically demands in the tenders for high energy efficiency for the products we buy. And then, of course, green growth and innovation. This is a photo of Radboud Hospital, which is one of our 3 biggest hospitals. They have been implementing an ESCO project for about the amount, I think it's about 40 million Danish crowns. And a part of that project are huge solar panels at the roof. I think it's the biggest solar roof installed solar panels in Denmark. Well, this ESCO, new ESCO project, what's the difference compared to normal ESCO projects? To the left, you see a normal ESCO project. That's 3-step screening, design, and implementation is done by the private ESCO partner. And there's no competition. So we thought about how to make a better concept. And the special thing about hospitals and big hospitals is that the hospitals are constantly changing. They're running 24 hours. In our case, we talk about lots of hospitals, and the energy efficiency initiative has to be done very quickly over a few years. So it's difficult. This warranty for energy savings, it's impossible actually to make it to maintain a baseline for the warranty. So the new concept we have designed is there's a tender. You see on the right, there's a tender. After the screening, analysis, and design, there's a tender before the implementation. That means there's a competition, market competition. There's a competition about the implementation, and that means that we're expecting better prices on our energy saving program. And instead of warranty, we are doing commissioning. So we hope this concept will prove better than normal ESCO for the hospitals. Well, how is it actually going? How is it actually going with the energy consumption? You see the columns. The green column is the electricity, the power consumption. Sorry, it's not the power consumption, it's the carbon emission due to power consumption. And the blue is the carbon emission due to heat consumption. And it's actually doing better than we expected on reduction on carbon emission for power, and that's actually due to conversion of the centralized plants. We have a national program for more wind power, and we have some big wind power mills has been started. So that's the main reason. The energy reduction, energy consumption has not decreased that much at the hospitals, but when these big ESCO project 3.0 is implemented, we expect a big reduction in energy consumption as well. And at the top right corner, you see the share of local renewable energy of the total electricity consumption at hospitals. And you see that it's less than 1%, which is of the electricity consumption, which is locally produced renewable energy. So and it will increase the coming years, but not that much. The transition in Denmark is driven by conversion to renewable energy in the public grid. And finally, I would say that we right now we are working with the development goals, the United Nations development goals, and trying to make a plan for the capital region where we sustain the goals where we can. And one very important part is partnership for the goals, and we'll try to be better at working together with, for example, Healthcare Without Harm and other global institutions to share knowledge and experiences. Finally, I would say you're welcome to contact me for further information, and thank you for listening to me.
Thank you very much, Ola. And for me, one of the main takeaways of what you just presented is almost 20% reduction from just energy efficiency. These are easy wins through behavior change. And here we'd like to end. Unfortunately, our time is very tight, but as said in the beginning, this webinar is recorded and will be published together with the individual presentations on our website. And if you have further questions, please don't hesitate to get in touch directly with our speakers or hit a message to us at europe@healthcarewithoutharm.org. Thank you for being with us, and enjoy your evenings or daytimes if you are in another time zone. Bye-bye.